First off, let's meet Henry. He's a 40-year-old male who drinks alcohol and is a seafood enthusiast. He complains of sudden pain in his left big toe, and it tends to intensify at night. On examination, there are no breaks or dislocations, but the left big toe appears red and swollen. First off, what is gout? Gout was once considered a king's disease, as it was most frequently caused by foods consumed by the wealthy. Gout has become a royal pain in the you-know-what for many modern-day sufferers. Gout is a type of inflammatory arthritis that occurs when uric acid, a byproduct of digestion, is either overproduced or cannot be excreted from the body. The accumulation of uric acid often results in the formation of uric acid crystals, not the type of crystals you'll find in Swarovski shops, in the joints. These crystals are identified as foreign invaders by the body and is attacked by white blood cells, resulting in intense pain, swelling, and inflammation, experienced as burning sensation. Many individuals with gout feel like they are alone, but the condition actually affects approximately 500,000 Canadians, and men over the age of 40 are 4 times more likely to experience the condition than women. Most often, the condition strikes the big toe, although it can affect the ankle, knee, foot, hand, wrist, and elbow as well. The risk factors for gout include a poor diet, alcohol consumption, obesity, high blood pressure, diabetes, kidney disease, a family history of gout, use of aspirin or water pills, and joint injury. What actually happens is that an excess of uric acid in the bloodstream causes the formation of crystals in areas of little blood flow, such as the cartilage, tendons, and ligaments. Gravity allows crystals to deposit in the toes, resulting in pain. Acute symptoms include throbbing, crushing, and excruciating pain, which frequently occur at night. You may be wondering why the pain frequently begins at night. This may be due to the cooler temperatures at night, which promote flare-ups. This may also explain why gout often strikes the big toe, because your limbs are furthest away from your heart, thus promoting a lower temperature. Chronic symptoms include tophi formations, which are deposits of urate crystals causing bumps at the side of the joints. Diagnosis. Joint pain and the presence of risk factors increase the likelihood of gout. Your doctor may use the following tests to confirm a diagnosis. Arthrocentesis is the clinical procedure of using a syringe to collect synovial fluid from a joint capsule. It is also known as joint aspiration. Arthrocentesis is used in the diagnosis of gout, arthritis, and synovial infections. Blood uric acid levels are not always accurate. Some people may have very high uric acid but have no flares. New evidence suggests that long-term high levels of uric acid in the blood may increase the risk for heart disease. Individuals with gout are more likely to have metabolic syndrome, which is a collection of risk factors that increase the risk for type 2 diabetes by 5-fold, triple the risk for heart disease, and overall increase the risk of death. Furthermore, elevated blood uric acid levels are associated with an increased risk of heart disease, regardless of the presence of other factors. As a result, patients with gout must not only make efforts to manage gout, but also protect themselves from associated conditions by regularly visiting their physicians, taking medications as required, and exercising regularly and eating well. This graph is showing that 62.8% of patients with gout had an associated metabolic syndrome, and 25.4% of patients without gout had metabolic syndrome. Gout is best controlled through lifestyle changes and medications, which we will discuss in the following slides. First, we will discuss the different types of medications because they are the most effective in reducing acute attacks. NSAID, which stands for non-steroidal anti-inflammatory drugs, will help decrease inflammation. However, if you are at an increased risk for heart disease, you should avoid taking NSAIDs. Cortisone, which is a steroid injection, can be given by a physician to the affected joint to reduce pain and inflammation. It is an acute, short-term therapy. Colchicine is a natural therapy that has been around since the 6th century, which is known to decrease inflammation as well. Oxycodone, on the other hand, helps reduce pain, but it is rare that your physician will prescribe this. When it comes to prevention, 2 medications often work better than 1. Some examples include allopurinol, Uloric, which is also known as febuxostat, and low-dose colchicine. Sometimes, patients who never had flare-ups start experiencing them when they begin taking allopurinol or other similar medications. It is normal to experience this because the medication is working to break down uric acid deposits that may have formed in joints, and the release of this acid causes symptoms like pain. It is important to continue taking your medication because long-term elevated uric acid levels can lead to kidney stones and tophi, like we discussed earlier, and also increase your risk for cardiovascular disease. Be temperate in wine, in eating, girls, and sloth, or gout will seize you and plague you both. Some lifestyle changes you should consider include lowering the intake of purine-rich foods such as red meats, organ meats, and seafood. This is because the breakdown of purines in your body become uric acids, which are later excreted through the kidneys. Alcohol prevents the excretion of uric acid by the kidneys, thus leaving excess uric acid in the bloodstream. Here are some do's and don'ts of lifestyle change. Do's include increasing your consumption of whole grains, vegetable-based proteins such as lentils, tofu, and peanut butter. Increase your consumption of low-fat dairy products, and that includes unprocessed cheese and yogurt. Increase your consumption of water. Eat an adequate amount of fruits and vegetables, especially those containing vitamin C. Some fruits that are rich in vitamin C include oranges, lemons, guava, kiwi, strawberries, and red peppers, since vitamin C helps to lower uric acid. Cherries have been found to lower uric acid as well. Continue to be physically active to improve quality of life and improve overall health risk. If necessary, avoid weight-bearing exercises such as running and jumping because that may aggravate your joints. Gradually lose weight. Because overweight and obesity are risk factors for gout and several other comorbidities, losing weight is advised. The following is a list of do-nots that you should keep in mind. Do not drink excessive amounts of alcohol or fructose-rich drinks such as sodas or juices. Do not eat large quantities of red meats and seafood. Rather, take fish oil supplements containing omega-3 to improve cardiovascular risk. Do not lose weight rapidly. Rapid weight loss can promote flare-ups. And do not drink excessive amounts of soft drinks and sweetened juices. You may take a moment to read the cartoon that we've decided to include in our presentation for your humor. Here are a few lifestyle tips that you can keep in mind. Gout flare-ups may be aggravated by hot and humid weather. You can cope with this by drinking water to stay hydrated. Although you generally ice an inflamed and swelling joint, you may want to reconsider icing a joint afflicted by gout since cooler temperatures can actually promote uric acid crystal formation. You also want to avoid putting heat on an inflamed joint because it will promote more inflammation. Rather, try taking a painkiller and resting the joint. Some individuals do not respond to current treatment options and/or doses. If this is the case, you are not alone. There are other options available to you. Tomorrow's treatments. As medical professionals, we are always striving to attain innovative treatments that focus not only on single medical condition, but also its associated comorbidities. The presence of clinical trials is what allows us to improve today's treatments and promote a healthier tomorrow. Clinical trials involve the recruitment of patients who are not benefiting from current treatment options, administration of a medication, either approved or investigational, observation of the medication's safety and ability to improve symptoms, and clinical observations and laboratory testing such as ECG, blood tests, and more. The benefits of clinical trials include 24-hour access to health professionals, access to important health information, compensation for your time and travel, and the advancement of medicine. Here is a list of some famous gout sufferers. Always remember, you are not alone. And that concludes our presentation. Thank you for joining us in our webinar today about gout. I hope the presentation was informative, and please feel free to ask any questions you may have. Thank you again.